This is government designed, government run. This is a big step toward socialized medicine. Period.
Constituents aren't happy with how things have been going. Our constituents aren't bought into the idea of single-payer socialized medicine. Our constituents have literally been hurt by the system as it stands right now, where it's become more expensive, where people have had to lose their doctor, where coverage has become less available, and honestly, where folks who have purchased or received some of these more ACA-type benefits aren't able to find or get the coverage that they need.
Because that's what this really starts to do. It really starts to spiral us downward to where more and more people are going to have to rely on this because we made it so unaffordable for their employers to cover them.
But I think it's one of those basic philosophical debates today about free enterprise and competition driving prices down, or monopoly single-payer systems keeping costs low. I have never seen in any economic theory where a single-payer system or a single entity drives costs down because they don't have to compete.
This will destabilize that market because we're going to underpay those providers. We've not lowered the cost for them to operate, and yet we're going to give them 60%. Now, if I'm a provider, am I going to rush in and do this? No. And so, yes, you have insurance, but who's going to take care of you?
Many of my colleagues here aren't just 45 minutes away, they're a couple hours away. And for those of you who don't live in that kind of place, I think it's not your fault that you don't understand that. It's impossible, I think, if your life is almost never more than about 15 minutes away from some kind of health care. In fact, I bet you most people here live only 15 minutes away from a hospital. But many people here live 2 or 3 hours away from a doctor or an emergency clinic.
My concern here is that we end up with a system where now the taxpayers are going to be paying for this, but with the 60% that's going to be paid to the doctors, if the doctors actually take this and they shift the cost over to the private pay, we're now going to make it more and more expensive for those employers who already are providing.
We all seek the same end goal, but and that is more affordable health care and more access, but we see different routes on how to get there, and I don't believe socializing it is the way to go.
If we continue down a path like this, there's just no math that winds up working out that says the private sector will be able to stay and survive. You know, the 10 or 20% of us who might still have a private plan, those plans aren't going to be able to pick up the cost difference from the 60% rates that are going to be paid out at the end of the day. And so insurance carriers will leave, and doctors will leave, and hospitals will close.
This is not a joint philosophy bill. This is a one-party majority philosophy bill that will be taking what we think a devastating step forward to destroy the markets and make it harder on our people, our consumers, to get a high-quality product at a good cost.
So I guess we're going to double down on what we know is a problem, and we're going to do this and say, well, this is going to save you money. But it's just an illusion of care because you're not going to be able to find those providers out in the marketplace. They're going to be willing to accept that. Vote no.